So good evening, everyone. Good evening, all veterinarians and my industry colleagues. Today we are very honored to have Dr. Senthil Kumar sir with us, and uh, and today we have in continuation of the webinar series, we have one more webinar today on comprehensive approach in treatment on bovine mastitis. So today's guest speaker is Dr. Senthil sir, and he's having more than 17 years of experience. Currently, he's working as a professor in veterinary medicine department, Tamil Nadu University. And so I request to sir, shall we start? Senthil sir, I am audible to you, sir. Senthil sir, I am audible.
ओपन योर माइक फोन लगा है उसका अनम्यूट करने की कोशिश करें
Sir, please unmute yourself, sir.
Is it okay, sir?
Yes, sir. Now it's audible, sir. Shall we start,
Okay.
sir?
Yeah, okay, fine. Good evening to everyone. First of all, I am very much thankful to the team Zenex for giving a wonderful opportunity, especially on a very important, nationally important, globally important topic, that is bovine mastitis. This bovine mastitis, it is not just merely a small thing. It has a larger entity. It has a larger ramification that affects many areas. Starting from any condition that affects the milk production, straight away affects the economy of the farmer. So it will have starting from the household economy to the rural economy and to the national economy. So it is very, very important to take necessary steps to contain and for quicker diagnosis and treatment is most important. Next. So what is mastitis? Next slide. So you can move to next slide.
Yes,
what is
sir.
mastitis is the term which denotes inflammatory condition of the udder irrespective of whatever the causes. So characterized by there will be changes in the physical appearance, then there will be change in the chemical medium of the udder, and there will be a microbiological changes in the udder milk, and pathological changes in the glandular tissue of the udder. So that is encompasses the mastitis. So changes in mastitis, there will be a different in color, starting from the yellowish to the with blood, without blood. So there will be a even a minor change. It will indicate there will be a mastitis. There will be change in the consistency, starting from the watery or with the flakes or without flakes, or with like a curd-like consistency, and there will be a change in the leukocyte count. There will be increased leukocyte count. So all that indicative that the animal is suffering from mastitis. The most costly disease infects the overall dairy economy. So by reducing the one way of total milk yield, and the total butter fat percentage. So mastitis milk unfit for human consumption. So economic losses, it includes by discarded milk and reduced milk production of the animal, reduced cost of the animal value. There will be due to the excessive cost of the veterinary services and treatment, and cost of increased labor for the management. But not only that, it has a wider ramification, including the public health, caused by the Staphylococcus toxemia, Streptococcus sore throat in the human, gastroenteritis in the human being. So we need to think in a broader way to take care of the, including the public health, not just mastitis, give you find a diagnosis and treatment. So we need to take into every aspect of the mastitis. So the sources of mastitis, if you see, self-explanatory. It is spread by the milk man who milking. It comes from the soil or from the bedding of the animal. Milking equipment, through the contaminated milk and through the water and other cloths or fomites, even with the other causes, all that lead to the mastitis. So if you see, there will be contagious mastitis is to the Staphylococcus aureus, that is predominantly, but that is also due to the Streptococcus agalactiae and Mycobacterium. Of course, if you see the environmental mastitis, E. coli mastitis, most a threatening one. Very usually, the incidence happens around the just a few days prior to the calving or immediately after the calving. Okay, so Streptococcus vivaris, Streptococcus agalactiae, Pseudomonas, Klebsiella. So if you see that teat skin opportunistic pathogens that gains entry into the, you see that is Staphylococcus, coagulus negative, or coagulus negative Staphylococcus. Then summer mastitis, of course, the Corynebacterium pyogenes. So the classification of etiology. The major pathogens which we have seen just now is the Streptococcus agalactiae. So it is also Streptococcus aureus and Mycobacterium bovis. And environmental pathogens, Streptococcus vivaris, Streptococcus discalactiae, and E. coli mastitis, Klebsiella mastitis due to Klebsiella. And of course, we have also reported scientifically coagulus negative Streptococcus and Streptococcus icus and Streptococcus chromogenes will be increased. Those are all increased in the first lactation of the animal. So the Corynebacterium bovis also often causes the mastitis, bovine mastitis. Nothing to leave. There will be even a small portion of other causes also causes mastitis like nocardia, Pasteurella multocida, and Mycobacterium hemolytica, Hempelobacter, leptospira of different species, fungal origin also trichospora, all that have been recorded. Of course, when you compare with this major pathogen cause of the bovine mastitis. Of course, if you see the predisposing connections, bedding, housing, of course, climate, then the milk machines, increases somatic cell count, opportunistic bacteria, usually stays when there is a reduced immunity, it will flare up. That is a source for mastitis. Pathogenic bacteria, of course, during the calving time, also predisposing. Already I have talked about the E. coli mastitis, very common just a few days prior to the parturition and immediately after the calving. Of course, the genetic factor also contributory for the bovine mastitis. Hygiene in the form of tongue or exudation due to, of course, placenta, retention of placenta, all the feeding stress contributory factor for the mastitis. The nutritional factors, that is the increased nitrogen content and protein also favor in the form of increased ammonia production and urea. That will be linked to the more incidence of mastitis. and the concentration of the energy also disproportionately increased. Then it is also a responsible and response for the mastitis. Then reduced calcium levels in the blood, responsible for a contributory factor for the mastitis cause. Of course, the poor quality silage that contains mold, that again decreases the immunity, that is response or prone for the mastitis. Some of the feed materials, uh, legume fodder, also a major or minor contributory factor for the mastitis cause. More estrogen containing legumes, premature development of udder, and that is again leading to the mastitis. So calcium and the selenium and the vitamin E deficiency, that is causing the immunity, reduced immunity, then by the incidence of mastitis. This selenium supplement may play a important role in the mastitis caused by E. coli. So why we are touching these nutritional factor, you will come to know at the time of treatment. It is not just merely a antibiotic or anti-inflammatory treatment alone is not sufficient, but also a nutritional supplement that will rejuvenate the alveolar tissue in the form of a minor nutrition or major nutritional supplements that is required for rejuvenating or rehealing the affected udder alveoli. So animal risk factors, you see the age and parity. The prevalence of infected quarters increases with the age or increases the number of calving, peaking at the 70 or at the level of third or fourth parity. So stages of lactation. So infection with environmental pathogens occurs during the early part of the dry period and in the first 2 months of lactation. Okay, he was high in the last trimester of pregnancy and several days before participation, followed by a marked decline after participation. So season of the here if you see subtropical and tropical areas, then the incidence of higher incidence is reported. So temperate climates and confined dairy herds, it occurs in the. So breed is also we can also so incidence is greater in HF or HF crossbreed. Then milking characteristics and morphology of udder and teeth. Milking rate and teeth canal diameter also plays a role in allowing or the entry of the pathogen. So milk leaking in the udder cows, that is giving some medium, a very good medium for entry of pathogen, that is ascending infection. Very common case of clinical mastitis. Teeth tend to the flow distance if it is short and very frequently touches or along with the tongue and urine or gives way for the entry ascending infection. Again, the teeth thickness or one way or other way allows mastitis. And hyperkeratosis of teeth orifices, again, it is a contributory, minor contributor of mastitis formation. So udder hygiene, if it is with contaminated with tongue or urine, very frequently that is increases the chances of mastitis by increasing somatic cell count, especially in contagious and environmental mastitis. The nutritional status, of course, we have talked about the selenium and the vitamin E. So mastitis is the pathogenesis, invasion through the teeth canal, that's ascending infection, and causes the multiplication and ends up with the inflammatory mediators that is causing the inflammation of the udder alveoli, that is called mastitis. So, systemic effects are caused by the mediators of inflammation. So, gross abnormalities of the milk, decreased milk yield, products of inflammation, and changes in the composition of the milk. The severity and the duration of the mastitis are critically related to the neutrophil migratory response and the bactericidal activity. So, we see these Staphylococcus aureus persistent but moderate infection. Mycobacterium bovis, chronic induration and complete loss of milk production without a recovery. So, in these cases, prognosis is very poor. So, the principal changes in adult tissues during the development of mastitis causes damaged milk cells, affects the milk, then affects the blood vessels that are supplying the alveoli, then atrophied villus, connective tissue, milk clots. So all there will be minute undetectable changes inside the. So now coming to the classification, the PACA classification of the mastitis, that is a peracute mastitis, acute mastitis, and subacute mastitis based on the clinical findings. Acute mastitis, chronic mastitis, or subclinical mastitis. Also, on more classification is available. So, peracute, if you see, general signs will be the anything it will cause the anorexia, depression, high fever will be there. Peracute, there will be high fever, sunken eyeballs, and there will be shivering and weight loss. In other changes, there will be increased inflammation in the form of a swollen udder, redness of hardness of the udder, it will be painful on touch. Don't allow the either the owner of the or the milk milking personnel to not allow to kick. The milk passes with the difficulty. Lactation often stops in the peracute form. In case of acute mastitis, there will be less fever, less depression compared to peracute. So inflammation of the teeth, there will be drastic drop in milk yield. Cases there will be pain, often follows swallowing, the cowing time. Cow goes okay. Then in case of subacute mastitis, there will be important signs will not be there, and such appears very healthy. Even the milk also there will be no not much changes physically. No apparent changes in the udder. Presence of flaky particles in milk, especially in the initial ejection of the milk. Sometimes in the case of subacute mastitis, you are unable to detect physically. The owner or they will say that upon boiling the milk, milk becomes curdly. That also indicative, a slight indication that it is subacute or subclinical mastitis, because there will be no apparent changes in the milk or that. So if you come to the subclinical mastitis, general signs, you won't see any clinical changes, clinical parameters. There will be no changes in the animal. Animal looks healthy. So to see the changes in the udder, milk appears normal. Only changes is direction of pathogenic agents in analysis, subjecting to the analysis by a culture. Okay. And increased somatic cell count. One of the important finding case of subclinical mastitis. There will be in subclassification also there based on the number of somatic cells per count. Okay. So most caused by the Staphylococcus aureus subclinical mastitis. Chronic mastitis, no signs at all. Okay. Repeated but mild clinical attacks will lumpy milk. Waters sometimes swollen, and quarters may become hard. That is fibrous or indurated. That is a fibrous udder. Upon touch, there will be hard consistent. Induration also. Then gangrenous mastitis, how often dies? It is toxin enters the systemic infection. That's why the first slide itself we have talked about the when there is our treatment aim, the diagnostic aim is early diagnosis and immediate onset of treatment to contain the pathogens within the adder, not to allow the pathological organism into the system to prevent systemic signs, bearing systemic signs. Okay, it will get confused. Multiple organ will be affected once the organism goes beyond the adder. So our aim is to diagnose early and institute the treatment very early to restrict the treatment within the adder itself. Okay. So case of the mastitis diagnosis, subjecting the milk, touching palpation of adder, and some laboratory tests like Dept and other battery of tests, laboratory tests. Of course, the bacterial isolation by the culturing, and then that treatment aspect also lies like ABST, antibiotic sensitivity tests. During that course of bacterial isolation, we have this ABST also will be very helpful at starting the treatment. So physical appearance, what are the changes, color changes, consistency, there will be pH changes towards the alkaline, specific gravity, and there will be in some cases there will be changes in the odor. And of course, the pH of somatic cell counts based on the first choice is California mastitis test. We have very field oriented. We can employ this CMT for faster diagnosis. In white side test, previously we used to test very field level test, white side test, very easy. Of course, the GCP test, BTP test, wherever the facilities like in our academic institutes, we have all the facilities of BCP, BTP, and electrical conductivity meter we have. Chloride test we can conduct, and so all that one or the other way we will diagnose the level of or the stage of or a degree of infection, whether it's a lesser degree or mild degree or moderate degree or higher or okay, this test will be helpful for staging the mastitis. Of course, the somatic cell count very important to for diagnose, not just merely field test. It also it can predict and prognostic. You can also use for a prognostic studies or predictive studies. We in our Tamil Nadu Veterinary and Animal Sciences University, we have developed a field level test which is called TANU check. TANUCHEK. TANU check we have developed. So very easy, farmer friendly. One farmer can test, a few drops of reagent has to be placed in the container, and a few drops of milk has to be put. Then mix it, and there will be a color comparison chart is available. Color comparison chart available. So even a farmer can can identify whether the animal will prone for the mastitis or not, or at the level at the time of test, what is the level of somatic cell count at this stage of mastitis. TANU check is the very farmer friendly test we have introduced in our university. Of course, the practical application of bacterial isolation ultimately ends up in the antibiotic sensitive test that will give an idea for which antibiotic has to be chosen for the treatment. The next treatment. Of course, the physical examination of both udder and milk is most essential simultaneously to judge the level. E. coli mastitis comes under very acute, most devastating. Once in our experience, we have seen that E. coli mastitis is the only mastitis that prones for the recommend like milk fever or partial paralysis or a downer cow syndrome, you must be aware that E. coli mastitis can also cause animal into a downer. Okay. So one such mastitis, very fast, it will be peracute, animal goes down. We are recommend. The onset is very fast, severe toxemia. And a special treatment line is required when compared to other Staphylococcus mastitis, Streptococcus mastitis. Okay, this E. coli mastitis occurs a combination of judicial combination of both antibiotics and other supplements, and also dilution of toxins like prednisone or make okay for antitoxinic properties. So there will be severe fever, depression, and dehydration will be there. Milk will be watery, thin, yellowish to the serous milk with flakes or without flakes. Sometimes with clots may contain blood also. Because in our experience, E. coli mastitis, we have tried to strip the milk. The milk will not come. There will be no milk. If at all comes, it will be very watery. Upon trying the little clots or with the blood, it's all physical methods of diagnosis itself, indicate that the animal is suffering coli mastitis. Of course, for confirmation, we need a microbiological culture. Okay. So Staphylococcus mastitis is very common, very common. Being the the Staphylococcus is more prevalent and around the farm premises. So easy access, easy ascending infection. So Staphylococcus is very common cause of mastitis. So there will be a curd like consistency based on that. One interesting differential diagnosis I wish to tell to the participants. Coli mastitis, there will be watery milk. Staphylococcus mastitis, there will be curd like consistency of milk. Streptococcus mastitis, whether you are heard or not, by our experience and the expertise, we receive a lot of cases in the academic institutions and colleges. There will be milk, the milk, water, there will be floating of a flake, floating of the flakes in the milk. That is streptococcal mastitis. Staphylococcus mastitis, there are thick milk, flakes, clots. For chronic cases, they have very little. Streptococcus mastitis, when milk containing small flakes, clots, stringes of fibrin, that will float. You can see the upper part of the milk. That's float. You can see if you are training. So mycoplasma mastitis, watery, sandy or grainy secretion. Fine flakes may resemble to the of course, you are very well that Leptospira crop control. Yeah, there will be blood pitch. That is the one is giving guidance. That of course, yellow, orange or cluster like this. The Pseudomonas aerobigenes of milk greenish yellow, woodland milk with foul wood. Important partner. Important symptom. Woodland milk with foul wood. We have some of the such cases. By physical examination, we take milk and send it for the microbiological culture. Found may contain blood. Klebsiella mastitis. While we are we have veterinary clinical complex, lot of things. graduate research program. Differential, not research topic. Now, one of treatment regimen.
Sir, sorry to interrupt. I think there is a network problem from your end because we are not audible to you properly.
Myself, sir.
Yes, sir. Now it's better.
I go to previous slide or just continue, sir?
Sir, you can continue from this slide, sir. Pseudomonas aeruginosa.
Next, go to the next slide.
Next slide, sir.
Yes, sir.
Correct, sir?
Yeah. Yes, sir. Yes, sir. Now you
Okay.
can see Bovine Mastitis, the left side of the stomach is very water. Okay. Namakkal mastitis, you can see curd-like consistent and the right upper. Okay, curd. Okay. The next slide, sir. Now you see the milk with blood. The other three quarters are. So, of course, the odor, we have talked about pseudomonas, all other things, there is no that much of changes. So, normal, just the white or creamy white. The acute mastitis, there will be a mild red or reddish. And chronic or subacute, there will be watery consistence. And yellow is color. Cholesterol, during the cholesterol period, feeding of carrots and citrus therapy are like to have influence over the odor. Pink to brown color, sometimes it may due to the other drugs like specific gravity mastitis is altered. So pH will be mastitis to go up to 7.4 against the normal 6.4 to 6.6. Border will be noxious mastitis in case of actinomycosis or pseudomonas. Ketosis, there is a concurrent change in the order of the Senthil protein. Of course, we have talked in general with the consistency of the milk. The next one, sir. Next slide, sir. Yeah. California mastitis, that's the principal the help of a handle. Based on the increased number of leukocytes in alkalinity due to mastitis, the 0.5 of milk plus reagent which contains BTD is equal to all the cups and mix. So it will precipitate the gel-like formation you will find. There is no precipitation. That's negative for the milk mastitis. If it is a streaky fluid, there will be weak positive for the mastitis. So again, we need to compare the somatic cells. So, slimy, moderately positive. The gelatinous gel-like is highly positive for it. So somatic cell count, we have a classification. We have talked about the classification. So 10 to the power 5 per ml of milk is the normal one. So anything goes beyond 10 to the power of 6 and above that there will be mild, moderate and severe degree of we have talked about this Tamil Nadu Veterinary Administration test for the subclinical mastitis based on the somatic cell count. That is check it. The technology has been transferred, widely used in field. That is checked. So now coming to the important area of treatment. So starting with basic things to the usage of higher version of antibiotics along with supplements. So starting with the isolation of healthy quarter must be killed the first and do not touch the other infected quarters. So emptying of the udder as much as possible to reduce the microbial load present inside in the particular quarter after quarter. The emptying of udder or a particular quarter is important first aid as a treatment for the mastitis. So the important is the culture isolate antibiotic sensitive test to find the which antibiotic is responsible for uh, more suitable for the treatment. Of course, the case is coming with previously treated or in the field level, they might be treated with veterinarian. So already, if it is in 2-3 days of antibiotics, may not give the right give a right organism in the culture. Of course, it will still give the idea for which antibiotic is more suitable. Okay. Intramammary immune infusion also we need to uh, give along with the antibiotic and the anti-inflammatory and the so systemic antibiotic therapy is to ensure further spreading of the organisms of the adversity. Okay. So supportive treatment like with the fluids, steroid, non-steroidal anti-inflammatory drugs, fibrinolytics and tissue regeneratives nowadays occupying the market. Tissue regenerator, utter alveolar tissue regenerative, or utter alveolar environmental modifiers. So all we need to judicially and rationally combine for early recovery or quicker recovery of mastitis. So complete milk letdown, the actuation also of the choice. The enzyme hyaluronidase, like in the form of serratiopeptidase, that will allow the antibiotic better diffusion or allow the antibiotic to reach all the areas of that alveolar tissue. So, of course, the heart fermentation also increases the blood supply and takes this antibiotic anti-inflammatory and the supplements to every part of the cell. Next slide, sir. So we need to use the antibiotic both parenterally and intramammary. Listen, intramammary antibiotic we are many a time we are skipping on intramammary infusion concept is it's an emerging, not just emerging, it's a proven concept that is to be uh, it reduces, highly reduces the microbial load within the udder. So that is helps in the way of further ascending of infection to the corticosteroids to check the toxemia case of not necessarily restricted to the acute or acute coliform mastitis. So if any mastitis is not controlled within the time duration, they will lead to the top. So use of penicillin is recommended, need to very you need to sense timing. So what things whether the NSAID we have to go for or just go for a particular treatment. So anti-inflammatory therapy is nowadays very naloxone, ketoprofen, and flunixin. Very good case of flunixin, much better. We have the experience of using flunixin. Gives good results. Flunixin, anti-endotoxin, so diluting the toxin produced or entered in the antihistamines are also one of the supportive treatment, integral part of the treatment regimen. Perfenel immediate. So local or topical applications, uh, anti-inflammatory gels Inflammatory ointment. So fluids, of course, is very much essential to dilute the toxins to avoid further systemic spreading of microorganisms or toxins. So to overcome dehydration is the primary objective, but also it has the direct objective to dilute the toxins. Normal saline, of course, not just normal saline alone. You can always use judicially combined plasma volume expander, hydroxyl cell starch. Many brands are available. I have the experience of using wet plasma very often. Gives a good result in case of fluids when you are combining with the antibiotic, anti-inflammatory, antihistamine, and intramammary therapy. Just combine the hydroxyl cell starch containing fluids and the fluids of normal saline to dilute the case of selective where it is.
Sir, your voice is not audible, sir.
Is it okay, sir? Now,
Now it's okay, sir. Yes.
light is one of the important components of the treatment line of treatment. So, light is like, so darkness is very much useful for better penetration of the antibiotics or drugs in every part of the culture. Fibrinolytics negotiate along with the system of along with alone alone or along with the available along with also available. So it is important to have combine the fibrinolytic and gold treatment of aspect. The next slide. Comprehensive parental antibiotic, local antibiotic form of from memory infusion.
Sir, we are not getting your voice properly, sir. There are lots of disturbance from your end, sir. Is it better? Can you find the proper network, sir?
So now it's okay, sir.
No, sir. Still some disturbance, sir. Now it's better, sir. Now it's better.
But parental antibiotic and local antibiotic in the form of from memory preparation. Amen.
Sorry for interruption, sir. We are not getting your voice properly. There are lots of disturbance from your side, sir.
now okay, sir?
Yes, sir. Now
Hello.
it's okay, sir. Yes, sir. Now it's okay, sir.
Go to the next slide. The stand plus other stuff we can always think of combining treatment.
So you can continue from this slide, antibiotic aqueous form intramammary.
Okay. So first one is penicillin. All based on the antibiotic test, antibiotic sensitivity test gives the idea for which antibiotic you need to use. Okay, next slide, sir. No, previous slide, previous slide. Yeah.
This one, sir.
Let's go to the previous slide, sir.
Yes, sir.
Yes, yes. Okay. So we can starting with subtractive, tetrabectum, tetracycline, we talked about. So that is good result. Sabaparatan, subtractum, and ultimately Septiopar injection. We can go for treatment according to the indication by antibiotics. So next slide, sir. The better usage of primary preparation, integrated treatment for arthritis. The advantage is well absorbed, well distributed. Those can be okay. We can go for the next one. So throughout this plus, we have tried methods, got a result, and then we all of the bolus contains the rest of the space along with paracetamol relaxin. So you can think of using this bolus along part of the treatment regimen for mastitis. This fully makes which contains the flunixin, which is be very helpful as anti-enterotoxin. So it's helpful for dilution of toxin in case of not necessarily restricted to the corrected or acute form of E. coli mastitis. It can be well used. The inflammation can well be used wherever you find that clear inflammation. We can use the containing fixin. Okay. So polemic AS can also be. Next slide, sir. Tissue aid. This is kind of it will be helpful for the tissue regenerative, alveolar tissue regenerative. I was talked regarding this antibiotic plus anti-inflammatory, antihistamine usage. We need to know these three things: either the antibiotic or anti-inflammatory or antihistamine does not have any role in rejuvenating the outer alveolar tissue, injured or affected alveolar tissue. So we need to look out for a preparation that will help for rejuvenating or the healing uh, affected alveolar. That's why the tissue aid will be that's helpful for early recovery of mastitis. It can also be used before mastitis system. So both way we can be used with nutritional supplements can be both way. We also can, of course, this melatonin well that is selectively talked to selective, so it should not have any side effects of damage or causing a GI tract will alterate. So that way we will have better advantage over other anti-inflammatory like yeah. Next one, sir. So apart from this antibiotic-based treatment, of course, the other concept is ethnoveterinary-based treatment. Ethnoveterinary-based treatment is emerging. You must be aware that ethnoveterinary cannot be ignored. Using as a traditional, using with the aloe vera and with turmeric and salt and that is a nice combination, well working. That can be made into a paste. It can be applied on the altar. So this aloe vera is about 250 gram and 50 gram of turmeric and about 15 gram of lime is to be pasted, made into a paste using the mixing. So it can be applied on the inflamed udder every 2 hours for about 5 to 6 times in a daily for 2 days. Along with your antibiotic treatment, this combination of with ethnoveterinary medicine, it gives early recovery. The treatment of the recovery phase is quicker. In case of antibiotic alone, you are using it, it is taking about 4 to 5 days. If you combine this along with the antibiotic treatment, ethnoveterinary, a day or two, it will be shortened for the ultimate recovery. That way, you need not ignore the ethnoveterinary medicine. So, I request you to include this ethnoveterinary medicine treatment for this mastitis also, especially in the case of acute or acute mastitis. Okay, you know that Dr. Punyamurti sir honored with the Purpose Award by disseminating this concept across the globe, across the awarded with the really useful along with the antibiotic. Next slide, sir. Of the preventive measures we get how to be water, health sequence, all that will helpful for the uh, management or prevention of mastitis. One more important managemental concept is the next slide. The next slide.
Yes, sir.
Next slide, next slide.
Next slide, sir. Okay. Before no, into one management concept that will avoid mastitis is immediately after calving. I mean, immediately after milking, the teat orifice relax, so that is opening. So that will, if the animal is lying down, it will favor for the ascending infection. What we can advise to the owner of the farm manager, we can advise immediately uh, feeding immediately after milking. The animal will stand for about even for about half an hour to 1 hour. By the time the teeth are closes, so in that way, after the animal lies down, to prevent infection from the adult ascending infection. Thank you very much for the wonderful opportunity for the team Zenex for disseminating whatever the knowledge we have to the global community, uh, directly or directly helping the farmers, helping the rural economy. Thank you so much.
Uh,
Uh,
Thank you very much, sir, for provide very insightful information regarding the mastitis, and main important, you already covered and discussed very nicely how to diagnose mastitis in field condition. As you discussed on the basis of clinical sign and symptoms, color change, milk color change, this will very helpful to detect the mastitis in field conditions. So, sir, we have received some questions regarding the mastitis. So now it's the question and answer session is open to everyone. You can ask your question by dropping a question in the chat box.
Hello? Hello?
Dr. Akansha?
Yes, sir.
I'm eager to.
Yes, sir. So, starting with the Q&A session, firstly, we received a question asking, sir, can we use tylosine in mastitis treatment?
Can you use?
Tylosine antibiotic, sir.
Yeah, it is. Yeah, it is the mastitis is not responding to the other antibiotics. We have the experience of using this tylosin. You know that is called a latent infection, on and off. It will come reacting and banning type of mastitis. So in that case, the tylosin is very much useful.
Okay,
Or
sir.
first, suppose the animal was previously treated for 2-3 days, then it is coming to you. You combine your with the antibiotic plus tylosin. A combined antibiotic, two combined antibiotics, you use tylosin, which will reduce the recovery days. Yeah.
Okay, sir. There was one more question, sir. Is there any simple homemade remedy for control of mastitis? I think, sir, you have covered this in the ethno-veterinary part of your presentation. So I think we got the answer that there is a simple homemade remedy also for mastitis. From field perspective, sir, the next question is how to identify the bacterial isolation at field level. So adding to it, sir, if see the field veterinarians when they are unable to directly isolate or culture, how would they identify the type of mastitis at field level?
Well, definitely it is not possible.
Any first basic rule to follow regarding this? Any protocol you can recommend to the field vets, sir?
That's we have talked about that. Increase the somatic cell count estimated by the TANU check. Even why not if the farmer using? We can always have being a vet. We can have a kit is just one test cost about 2.5 rupees only. TANU check. TANU check kit you can buy one test. It is costing just 2.5 rupees only. That way they can even predict the animal will go for mastitis maybe after a month, after 2 weeks. Okay, that way we can predict also.
Okay, sir. The next question is any one antibiotic, long acting and economical, that targets wide range of bacteria that you can suggest.
The exon with the aspect oxalate gives good result. In our experience in endamate and enterofloxacin also can good result. But
So, yes, sir. Antibiotics like Enrodec also, sir, they can be effective. Enrofloxacins.
we cannot say exactly, but only we can share the experience. Otherwise, the best way, we are in the academic line, so we have the facility of culturing and immediately find the which antibiotic by the of antibiotic sensitivity. We have the that facility. So for the field people, can go for the aspect of mother. Second, also,
Okay, sir. So next question is, what is the role of isoflupridone or isoflud in acute mastitis?
we have talked about the usage of corticosteroids. That it will faster reduce the inflammation. And the acute and peracute mastitis cases we can combine. With
Okay, sir.
always with the higher antibiotics. With always we have to ensure that there is antibiotic coverage is even along while they are preferring isoflurane.
Okay, sir. Next question is, sir, what is the best treatment of gangrenous mastitis?
Already it is gangrenous, no way, only to it will not recover. only just removal, surgical removal,
Okay, sir.
to
So
contain further spreading.
any preventive measures that can be followed, sir, from conversion of a clinical case to gangrenous case, perhaps?
Can you repeat that?
Yes, sir. Any preventive measures that can be followed in cases of gangrenous mastitis?
So, just on the steps to take the broad spectrum or identified antibiotic combination to enter contain before the concept of gangrene. Once it is coming, there is no possibility. Once established gangrene only we can prevent before entering the gangrene state by using the strong antibiotic and anti-inflammatory along with the intramammary and the uh, anti-inflammatory.
Okay, sir. Next question is, sir, how to identify the mycoplasmal mastitis?
By way of culture.
Any relevant signs and
We have the
symptoms?
facility. In our college we have the
Okay, sir. One more question, sir, from the point of field veterinarians. If they are treating the mastitis case, say using intramammary preparations like pendestrin or pendizide, if what is that point where they have to switch to like systemic or parenteral treatment with antibiotics like ceftriaxone, ceftan, if we talk about. So how do they decide that they have to switch from intramammary to parenteral?
if it is not responding, if not today, we need to go for an upgraded version of intramammary and along with the upgraded version of the antibiotic. We quickly understand one who is following up along with the symptoms told by the animal wonder. So the following by the vet. So there must be a good follow up and interaction. So based on that, on the physical findings of both the adult changes and the milk changes, all we need to combine to take a decision.
Okay, sir. Next question is, sir, is it useful to use two antibiotics at a time in mastitis? And if so, how to choose?
Uh, Pardon?
So is it useful to use two antibiotics at a time in mastitis? And if so, how to choose?
Yes, it is necessary because we know very well that the market is established by the microorganisms. Uh, so it is important to use the antibiotic and how to choose this in the field level. We have very difficulty. Of course, in our the antibiotic sensitivity test is the right choice. Otherwise, no, we can go for the medicine combination of antibiotics for a early start of treatment method.
Okay, sir. Next question is, sir, what can we use in gangrenous mastitis? As you have already, I think, discussed before also, sir. Any
Uh,
suggestions in, yeah. So the next question we can move on to, sir. Tylosine antibiotic, does it cause a change in milk taste?
No, we are not. No, first our primary aim is to contain the further spread. Our primary aim is to recovery from the mastitis. That we are not. No, that is comes very less important. Our primary focus is for recovery.
Okay, sir. So the next, both the questions, they are asking about the ethno-veterinary medicine that you suggested. So could you please briefly touch upon it again and talk about it, since I think your audio was a little broken during that part of the session. So if you could please just uh, reflect on it a little.
To comprehend,
Yes, the ethno-veterinary homeopathic remedy that you suggested, sir. If you could just briefly touch upon it again.
Sir, shall I reopen that presentation for ethno-veterinary treatment for mastitis?
Yeah. Extraordinary they want.
Okay.
Okay,
Yes, sir,
okay.
I have. I'll reopen it. Sir. Wait, sir.
Yeah, I can tell. This you have to take 250 grams of aloe vera, 50 grams of turmeric, and 15 gram of lime. All, all the three has to be mixed using the mixing with water to make it into a paste with the consistency not to lose drop. So it has to be applied on the inflamed adder at 2 hours interval, 5 to 6 times a day for 2 days. This is the method to use. Noted. This is a wonderful research. Not just alone, but along with the.
Okay, sir. So,
Shall I tell once again the 250 gram of aloe vera, 50 grams of turmeric, and 15 gram of lime. Okay. It is available on our Tanu's website.
with this, I think
If someone is more interested in ethno-veterinary medicine, we have with our Tamil Nadu Veterinary and Animal Sciences University, we have a standardized that is available in the NDDB website also, uh, as a PDF. For all the other conditions, not just mastitis, pyrexia, other including infertility conditions, or LSD also. Let us hold it LSD. So you can have lot of information in the TV website as well as in the Tamil Nadu website for ethno-veterinary treatment of many conditions of pregnancy.
okay, sir. Thank you, sir. That I'm sure that it was helpful. Just last one more question we have received, sir. What is the role of phytolacca in mastitis?
Yeah.
I,
He is talking about the this homeo medicine alone. The phytolacca alone, 30 potency, he give 10 drops BAD for about 2 weeks. Still no wonderful result if it is alone used. When you combine with the antibiotic, then no, it gives faster recovery. That's all. Fibrinolytic property, the principal property is fibrinolytic, but still no, alone, phytolacca alone may not be helpful.
so with this, we have completed the questions, sir. So thank you so much, sir. We at Zenex extend our sincere thanks to you for giving us your valuable time. And also thank you to all the participants for joining the session and encouraging the knowledge forum that we have over at Zenex. So we'll plan future webinars. We will keep them coming for you all, so more and more technical sessions. So thank you so much, sir. And hopefully
I,
we all
I,
have
too, I,
learned a
thankful
lot.
I too thankful for the Zenex for having the chance to speak to across the for disseminating whatever the knowledge we have. Thanks for the participants who are patiently listening. Thanks so much. Try to apply. Thank you.
Thank you very much, sir. Thank you.
Thank you, sir.